So good afternoon and welcome to this final session of the conference on contrast perfusion imaging. I'm Massimo Mischi from the Eindhoven University of Technology, and I will be chairing this session and by chance also giving the first talk. So I will start telling you about fractal dimension of tumor microvasculature by dynamic contrast enhanced ultrasound. This work results from the collaboration between the Eindhoven University of Technology together with the Academic Medical Center in Amsterdam and the Academic Hospital in Kiel. This work is based on the link between cancer growth and angiogenesis, the development of a disorganized and chaotic network of microvessels feeding the tumor. So the objective, the diagnostic objective of this work is therefore to characterize this microvascular architecture in order to be able to detect and localize cancer. Of course, this is quite challenging because we are talking about microvessels that are beyond the resolution of ultrasound. And in order to overcome this problem, ultrasound-contrast agents are giving us really a big help. In the past years, we have developed contrast ultrasound dispersion imaging, which is a new technique in order to characterize the microvascular architecture as reflected in the dispersion kinetic of the agent traveling through tissue. These are a number of publications that also present the different implementations of the method. Here you see some parametric maps, and in fact, this was also confirmed by MRI, by which we also implemented the models that we are using, and were also resulting in quite good results. And good results, I mean good agreement with the histology after radical prostatectomy. These are all cases in which the method was applied for prostate cancer localization. Of course, the problem remains that we are comparing the microvascular architecture with the ground truth that actually represents the so-called Gleason score in neurology. And this is related to the cellular differentiation and not to the microvascular architecture. Therefore, a number of questions remain open. So what is the link between contrast agent dispersion and the microvascular architecture? Moreover, since we are talking about architectures, we are also thinking, well, is there also some role in all this that also the fractal dimension of this architecture can play? Can we somehow estimate the fractal dimension and link it with the microvascular architecture by using ultrasound-contrast agent and contrast ultrasound? So to answer these questions, we made this analysis. We imaged, in fact, 14 mice xenograft models after injection of two different types of cancer lines, PC3 and DU145. And these two cancer lines actually result in a different distribution in space of the microvasculature. And we wanted to check whether without approaches, we were able to detect this difference. We used a visual sonic Vevo system, 2100, imaging at 18 megahertz with a low mechanical index, with a frame rate of 10 hertz. And after the injection of a 100 microliters bolus of a micromarker. Here you see the resulting indicator dilution curve after the injection. You see also fit here by the modified random, local density random walk model. So this was the image in contrast mode, and here at each pixel, in fact, we derive such a curve. For comparison, we did a validation by using immunohistology. So the mice, after imaging, were injected with tomatolectin, which was let circulate for 8 minutes. And after tumor resection, this was stored at minus 80 degrees and then cut in micro slices of 5 microns, which were then imaged by fluorescence microscopy. In some cases, this was not really successful. We do not detect enough fluorescence, and therefore these tumors were again cut in thin slices, and CD31 staining was then used. Based on the result, you see an example over here. What we did is to estimate the microvascular density by looking at the gray levels in the image after low-pass filtering. So here are two examples of DU-145 and PC3 cancer lines, and these are the CUDI images, so contrast ultrasound dispersion imaging results, where you see, in fact, that in DU-145, we saw a core that is hypervascular with respect to the periphery, while a much more homogeneous distribution of the vasculature can be seen in PC3. Is this actually true? Well, this was confirmed by the literature from some previous studies that we did and also some studies in nuclear medicine. However, most importantly, we looked at the MVC, microvascular density measured by immunohistology, and both CD31 staining and fluoroscopy of bound tomatolectin confirmed, in fact, these results. A hypervascular core in the case of DU-145, while a more homogeneously distributed microvasculature for the other type of tumor. Now is the point, can we estimate the fractal dimension from these maps? And in particular, we were looking at the fractal dimension of the flow distribution. The fractal dimension can be calculated by looking at the relative dispersion of the flow, at the flow distribution. Relative dispersion is assessed as the ratio between, it's not really convenient, as the ratio between the standard deviation of the subsamples of tissue that we are taking and the mean value of the flow indicator that we are using. So basically what we do is to take one zone, one area that we have analyzed, determine a flow map, this has still to be extracted, and then subsample this zone at different levels. And at each subsample, we measure let's say the gray level, or anyway the feature that we use to identify the flow. And then at the different levels, we estimate this ratio between the standard deviation of the flow levels in each subsample and the mean value. Once we do that, eventually the fractal dimension is given by this exponent. So we can basically fit this model to the different values and extract the fractal dimension. Which flow map do we use? Well, we used as a representative of flow the washing rate of the contrast agent and the peak intensity of the indicator dilution curve. Here you see two examples for DU-145 and PC3, and in fact, here you would expect this hypervascular core, but this is not reflected in the perfusion maps, while you will see it reflected with all the other maps. So in fact, the way we proceed, as I already told you, we take the entire zone that you want to analyze, and we look at the ratio between the relative dispersion with respect to a reference level or subsample. Our reference level is taken by taking 4 subsamples. So this is our reference. We calculate the ratio between standard deviation and mean value of the flow in these 4 blocks, and this is referred to 1, because this is our reference. And then we can proceed, so refer to this value. We can subsample further and further and further, and what we do is we fit this exponential model to this curve, and we can estimate the fractal dimension over here. Of course, this method is not immune from error. There are a number of error sources, and these are mainly due to flow variations. When the tissue subsample is close to the microvessel scale, when the tissue subsample is smaller than the image resolution, and in the presence of image noise, these are all error sources. But in our case, we are in fact fortunate, and we fulfill all the requirements in order to be able to neglect these error sources. In fact, the flow is peaked by peak. We use the peak intensity and the washing rate, which is the average result for the entire bolus passage. So we are immune to variations. The tissue subsample, well, the pixel size is of the order 45 times 45 micrometers, which squared, which is quite larger than capillaries. Microvessels are of the order of 10 microns. Our tissue subsample, as I told you, is 4 pixels, which is larger than the resolution cells that for our imaging system was of the order of 80 times 80 micrometers. And noise can be modeled, especially for high concentration after linearization with a Rayleigh distribution. And the beauty of a Rayleigh distribution is that the ratio between standard deviation and mean is constant, and as a result of that, it does not affect our estimation of the fractal dimension. So in order to validate our system, what we did, we looked at the microvasculature in the center and in the periphery of our maps, and we estimated in these two zones the relative fractal dimension, see, the difference in fractal dimension between the center and the periphery compared to the fractal dimension in the center. So this is the way that we validated our imaging methods, and in particular we wanted to see whether in the two types of cancer lines we were able to find a significant difference of this parameter. And in fact, we did. So here you see the results for all the imaging approaches that we took. So this is our fractal dimension using the peak intensity and washing rate map, and you see a significant difference with p smaller than 0.05. Actually, the difference, the relative difference by using contrast ultrasound dispersion imaging was even more significant. You see it here, and the same applies to the microvascular density by using immunohistology. But in any case, you see how all these techniques are in agreement, and we're able to detect a hypervascular core for the DU145 type of tumor compared to the other one. And this was not detectable by using the relative difference of peak intensity and the relative difference in washing rate. So flow measures were actually unable to detect this difference, different from the other flow measures that we have investigated. So to conclude, by using mice xenograft models, we were able, of DU145 and PC3 cancer lines, we were able to develop tumors that were differentiated in space in microvasculature. And by doing the analysis of this cancer, we were able to detect this difference in space in the microvascular density, and therefore in their architecture, by using contrast ultrasound dispersion imaging. That is the technique we had already introduced a couple of years back. And in agreement with these results is also the new fractal dimension assessment. Of course, the significance, as you can see, was slightly smaller. On the other hand, if you think, for instance, in terms of a multi-parametric approach where different, possibly complementary indicators are all integrated in order to improve and boost the classification performance, the fractal dimension can indeed provide quite relevant information that you can still use for diagnostics. We're talking about diagnostics, but what we did so far is actually to use the entire zone, knowing already beforehand that one was should have been hypervascular and the other one should have been different. If you want to do diagnostics, we should be able to generate a parametric map of sufficient resolution in order then to make a diagnosis based on our parametric map. This remains still a little bit challenging because of resolution limitations of this approach. However, we have seen quite several presentations also during this conference about super resolution, and perhaps by using some deconvolution approach, this might be the way in order to bring also this technique to the resolution for diagnostic purposes. Thank you for your attention. If you have questions.